Hello, welcome, and thanks for joining me on this presentation regarding vulnerable populations in nursing. Today I'm going to be focusing on individuals with an intellectual or developmental disability, commonly referred to as IDD. This contains a group of diagnoses that include conditions such as autism, Down syndrome, or another developmental delay. I chose to cover this population because I've spent the last 3 years working as a case manager for an agency that serves individuals with IDD. Through this experience, I have unfortunately seen how fragile this population can be and how easily they can fall through the cracks of our healthcare system. People with IDD often face complex medical, behavioral, and social challenges that can make accessing equitable healthcare really difficult for them. In this presentation, I'm going to talk about several key perspectives, including nursing science, nursing theory, evidence-based practice, even talk about servant leadership and interdisciplinary collaboration, and using all of these to understand how nurses can provide compassionate, competent, and equitable care. My goal today isn't to just discuss these challenges that the population faces, but also highlight some practical evidence-based strategies that nurses can use to improve health outcomes and promote inclusion across care settings. To start things off, I just want to talk about what a vulnerable population is. A vulnerable population is groups of people who are at an increased risk for poor health outcomes due to a variety of things that include social, economic, or health-related disadvantages. According to the National Institutes of Health, this includes individuals facing barriers to care, financial hardship, or even discrimination. The focus of this presentation is on individuals with intellectual and developmental disabilities. This population includes those with varying levels of intellectual function and adaptive skills. It is really important for nurses to understand this group because this group faces disproportionate health disparities. They have limited access to preventative services, and they frequently have unmet health needs. Throughout this presentation, I will provide background on how these disparities interplay in this population's lives. I will also review evidence-based practices, connect nursing theory and science, and then explore how some leadership and collaboration can bridge the gap towards equity and inclusion. Let's begin with some background. Approximately 6.5 million Americans live with an intellectual or developmental disability. This is according to the Administration for Community Living, and it represents roughly 3% of the U.S. population. Adults with IDD are about 3 times more likely to experience unmet healthcare needs compared to individuals without disabilities. In addition, both children and adults with IDD have higher rates of ER visits and hospitalizations. These disparities arise from a combination of factors, including medical complexity, communication challenges, and even system-level barriers such as limited provider training and inaccessible healthcare environments. Based on my own personal experience working with this population, these statistics unfortunately do not surprise me at all. I often have to send my clients for multiple medical evaluations before their needs are adequately addressed. Just last week, for example, I sent a client to urgent care for an orthopedic concern, but the provider actually refused to see her because she was nonverbal. As a result, she got to spend hours in an ER for what should have been a straightforward X-ray. Another important factor to consider, especially when discussing the cost of care, is the financial vulnerability that many individuals with IDD face. The majority are unable to work and must rely on public assistance for income. One of my clients actually receives less than $900 a month. After paying for food and housing, that leaves very little for personal needs or for quality of life activities. Once medical expenses are added, that financial flexibility becomes almost non-existent. A final point that I do want to emphasize from my experience is the difficulty in navigating the healthcare system for individuals with IDD. Many do not have the cognitive ability to remember appointments, and they may even lack the financial means or transportation to attend them. Navigating healthcare and insurance is challenging for anybody, but adding an IDD diagnosis can make it nearly impossible without support. These real-world barriers highlight the critical role of nursing advocacy, care coordination, and patient-centered planning to ensure that individuals with IDD receive timely and equitable healthcare access. The Developmental Disabilities Nurse Association, or DDNA, plays a critical role in addressing these issues. During its annual conference in May 2025, DDNA highlighted the ongoing shortage of specialized services for this population. As of that date, there were only seven providers nationwide who were formally specialized in IDD care. Furthermore, DDNA's most recent membership census from 2021 reported just 924 members across the entire U.S. This reflects the significant gap in specialized training and the limited professional resources available for nurses that are serving this population. Because many nurses have little to no exposure to developmental disability-specific education, care gaps are very common. DDNA is working closely to try to close this gap through certification programs, continuing education, and clinical resources that enhance nurse competency and confidence in caring for individuals with IDD diagnoses. But ultimately, understanding these statistics and workforce limitation truly does underscore the importance of our advocacy, individualized care planning, and effective communication strategies. As nurses, we have both the opportunity and the responsibility to provide equitable, high-quality care for everyone, but especially this vulnerable population. Evidence-based practice integrates the best available research evidence with clinical expertise and patient preferences. For individuals with IDD, evidence supports that the use of routine health checks and screening programs to identify chronic conditions earlier. These proactive approaches help reduce preventable hospitalizations and improve long-term outcomes. Behavioral interventions such as including structured communication strategies, visual supports, and family or caregiver involvement have been shown to enhance safety, understanding, and treatment adherence. The Developmental Disabilities Nurses Association, or commonly referred to as DDNA, emphasizes that nurses with specialized knowledge in developmental disabilities play a pivotal role in reducing health disparities and promoting inclusion across the entire healthcare system. Through their advocacy efforts and continuing education programs, DDNA helps elevate care standards and support nurses in providing high-quality, person-centered care for individuals with IDD. Furthermore, the Centers for Disease Control and Prevention reports that implementing IDD-specific clinical protocols improves preventative care adherence and decreases hospital readmissions. As nurses, integrating these evidence-based strategies into daily practice involves adapting our communication approaches, utilizing individualized assessment tools, and advocating for system-wide adoption of inclusive, accessible care guidelines. By doing so, we not only improve health outcomes, but we also uphold the nursing commitment to equity and compassion. Nursing science underpins all aspects of professional nursing practice. It involves systematic study, theory generation, and application of evidence to improve patient outcomes. Current nursing research highlights that individuals with IDD face unique comorbidities such as obesity, epilepsy, and behavioral health disorders, which are often managed by multiple specialists. Through nursing science, we use patient-centered assessments, data-driven care plans, and evidence-based education strategies to improve these patients' quality of life. Outcome metrics informed by nursing science, such as reduced hospitalization, improved functional independence, and higher patient satisfaction, allows us to measure the impact of interventions. Ultimately, nursing science bridges the gap between research and bedside care, and it makes sure that the interventions that we are implementing are safe, ethical, and person-centered. Gene Watson's theory of human caring centers on the idea that nursing is both a science and an art, one that is grounded in compassion, intentional presence, and human connection. This theory emphasizes caring as the moral and philosophical foundation of nursing, reminding us that healing extends far beyond physical treatment. It involves attending to the mind, body, and spirit of each person that we serve. For individuals with an IDD diagnosis, this theory is especially powerful. These patients face many barriers when it comes to everyday life, much less in a healthcare setting, in terms of communication, misunderstanding, and even social stigma. It can result in the healthcare environment feeling impersonal and even unsafe. Watson's framework calls nurses to move beyond task-oriented care and focus on building authentic relationships built on empathy and trust, all values that align with the principles of inclusion and dignity central to developmental disability nursing. In practice, this means slowing down to meet the patient where they are. For example, a nurse might take extra time to build rapport with a patient who has limited verbal communication, using gestures, visuals, or familiar routines to establish comfort and understanding. It might even mean involving caregivers and family members in shared decision-making to ensure that the patient's needs and preferences are actually and accurately represented. It could also mean adapting the environment by lowering noise, dimming bright lights, or using sensory supports to reduce anxiety and promote calm during care interactions. By applying Watson's theory in this way, nurses can cultivate a deeper sense of empathy and therapeutic presence. This helps patients feel seen, heard, and valued, not just as a diagnosis, but as a unique individual with strengths, emotions, and stories. Ultimately, the theory of human caring guides nurses to create a healing environment where both the patient and caregiver experience mutual growth, respect, and compassion. This approach not only enhances the quality of care, but also reinforces nursing's ethical duty to uphold human dignity and advocate for the most vulnerable members of our communities. Servant leadership prioritizes service before self, focusing on empathy, listening, and empowerment. In nursing, servant leaders act as advocates, not only for patients, but for colleagues and systems of care. For individuals with IDD, this might mean promoting accessibility initiatives, mentoring other nurses and communication strategies, or even leading advocacy efforts to improve policy and care standards. By embodying servant leadership, nurses can transform the culture of care. They can foster inclusion, respect, and empowerment at every level of the healthcare system for all populations. Interdisciplinary collaboration is really essential for comprehensive care. The CDC emphasizes that fragmented care can lead to poor health outcomes and higher costs. Effective teams include nurses, physicians, therapists, social workers, behavioral specialists, pharmacists, all of which are contributing their own unique expertise. For example, a coordinated care plan for a patient with autism may include a nurse managing medical needs, a speech pathologist supporting communication, and then a behavioral therapist guiding coping strategies. Research by Sonderland et al. 2024 shows that collaborative care improves continuity, reduces hospitalizations, and also enhances community integration. Nurses often serve as the central coordinators, ensuring that communication among providers, caregivers, and patients remains clear, compassionate, and consistent. Nursing education plays a vital role in preparing future nurses to care for individuals with IDD. According to DNISCO 2024, educators should embed real-world specific content into simulation experiences and case-based learning into their curriculum. For example, a nurse educator could formulate a simulated patient encounter that involves communication barriers or sensory sensitivities to help students gain confidence and empathy before entering practice. DDNA provides evidence-based frameworks and resources that nursing educators can use to prepare students for real-world practice. By aligning education with DDNA standards, educators can help ensure that nurses are competent, confident, and compassionate in caring for individuals with IDD. Research by Canlu et al. 2023 also suggests that nurses who receive focused IDD training demonstrate improved competence and confidence, which leads to higher patient satisfaction. Ultimately, Nursing educators are instrumental in shaping a workforce that is inclusive, informed, and compassionate. When I think about servant leadership in nursing, I think it's one and the same. Servant leadership and nursing both prioritize putting the needs of others first and fostering a culture of service, humility, and compassion. For example, in Matthew 25:40, it reminds us that we need to treat every patient with respect and dignity, because caring for the vulnerable is equivalent to caring for Christ himself. In practice, this could mean taking some extra time to understand patients with IDD, especially if they're nonverbal, by observing their behaviors, consulting with caregivers, or using alternate communication tools to ensure that their needs are truly being heard and met. Advocacy and empowerment are also central to servant leadership. Proverbs 31:8 and 9 encourages us to speak up for those who can't speak for themselves. In nursing, this may involve addressing barriers like inaccessible clinics, lack of transportation, or limited provider knowledge. For patients with IDD, it can mean advocating for accommodations during appointments or helping them and their families navigate the healthcare system so that they have a voice in decisions that affect their care. Empowerment is not just about speaking for them, but it's about enabling them to participate as fully as possible in their own care. Ethical decision-making is equally important. Micah 6:8 calls us to act justly, love mercy, and walk humbly. In nursing, this translates to aligning clinical decisions with professional standards while also maintaining personal integrity. For example, when resources are limited, we may need to prioritize interventions equitably, ensuring that transparency is in our actions and always acting in the patient's best interest. Integrity ensures that we are consistently upholding ethical care, even in complex or stressful situations. Finally, Mark 10:45 teaches us that the essence of servant leadership is that true leaders serve others. As nurses, we embody this when we put our patients first, when we mentor our colleagues, and when we cultivate a culture of collaboration and compassion. For individuals with IDD, this could look like patiently explaining a procedure, supporting their caregivers, or leading initiatives to improve accessibility and inclusivity within the healthcare setting. Incorporating these principles into daily practice is not only ethically and spiritually meaningful, but it directly improves patient outcomes. By demonstrating empathy and advocating for our patients and acting with integrity, we can ensure that this vulnerable population is treated with dignity and the respect that they deserve. Now that we have explored each component, evidence-based practice, nursing science, nursing theory, servant leadership, and interdisciplinary collaboration, let's bring everything together and consider their collective impact. When these elements are integrated, they create a comprehensive framework that not only enhances clinical outcomes for individuals with IDD, but also transforms the culture of healthcare delivery itself. Through evidence-based practice, nurses use data and research to guide interventions that are proven to work, such as health checks, structured communication, and caregiver involvement. Nursing science provides the foundation for understanding the physiological, psychological, and social complexities that affect this population. Nursing theory, such as Watson's theory of human caring, reminds us to approach each individual holistically with empathy and dignity. Servant leadership motivates us to advocate and act selflessly for those who may not be able to speak up for themselves. And interdisciplinary collaboration ensures that no one provider carries this entire burden of care. Instead, nurses, physicians, therapists, social workers, and pharmacists work together to support the entire person. However, even with this strong framework, we continue to face systemic barriers that limit equitable care. Many healthcare professionals still lack adequate training in developmental disabilities. This leads to communication gaps, misinterpretation of behaviors, and even misdiagnoses. Structural inequities such as underfunded support programs, fragmented care coordination, and policy limitations further widen those disparities. Societal stigma and an unconscious bias can also play a role, which often results in these individuals being treated as less than capable or deserving of compassionate care. To address these challenges, nurses must take an active leadership role. This includes developing and participating in targeted education programs that equip healthcare workers at all levels, from nursing assistants to advanced practice providers, with the skills to care effectively for patients with IDD. Nurses can also serve as advocates within their organizations and at the policy level, promoting inclusive practices, staff education, and accessibility standards. At the team level, interdisciplinary collaboration must become the norm, not the exception. Speech-language pathologists, occupational and physical therapists, behavioral specialists, and social workers all contribute unique perspectives that, when combined, create a more comprehensive and person-centered plan of care. As the World Health Organization and American Public Health Association emphasize, achieving health equity for individuals with IDD isn't optional. It's an ethical and a professional obligation. By uniting nursing science, theory, evidence, and leadership, we can begin to dismantle the systemic barriers that have persisted for decades and build a healthcare system that truly serves everyone. In conclusion, individuals with intellectual and developmental disabilities represent a vulnerable yet resilient population that are deserving of compassionate, evidence-based nursing care. Regardless of cognitive or functional level, these individuals are people just like you and me. They want to feel safe, valued, and included. Across all levels of healthcare, from nursing assistants to advanced practice nurses, physicians, therapists, social workers, there is a critical need for specialized training in caring for individuals with IDD. Every provider who interacts with this population should have a foundational knowledge in communication strategies, behavioral support, and trauma-informed care. Organizations like DDNA are leading the way in providing this training, but there is still widespread integration across the healthcare disciplines that's needed. Unfortunately, the lack of understanding and preparation among healthcare staff can lead to devastating outcomes. I experienced this firsthand with one of my own clients who was hospitalized last year. Because Medicaid and Medicare prohibit the agency staff from attending to patients in the hospital as they consider it double billing, he was left in the hands of the hospital team. Despite being gentle and fully toilet trained, he was restrained in 4-point restraints, placed in a diaper, and isolated with the door closed so that his cries and yelling could not be heard. That was for the entire hospital stay. He wasn't aggressive, he was just simply confused, frightened, and unable to understand why he was there or why these strangers were caring for him. This experience profoundly reinforced for me that when individuals with IDD are hospitalized, they have to be treated as a human first. Their rights, dignity, and autonomy must never be compromised because of communication barriers or cognitive limitations. Every healthcare worker should be equipped and empowered to deliver compassionate, person-centered care, not just medically competent care. Through nursing science, we deepen our understanding of their needs. Through nursing theory, we practice with empathy and dignity. And through evidence-based practice, we drive measurable improvements in outcomes. Through servant leadership and interdisciplinary collaboration, we advocate for systemic change, ensuring that no patient is overlooked, unheard, or mistreated. My call to action for all nurses, and honestly all members of the healthcare team, is to advocate, educate, and innovate. Advocate for inclusion. Educate yourself and others about this population's unique needs. And innovate by building systems that ensure that every patient, regardless of ability, receives equitable, high quality, and humane care. The next 3 slides list the sources used to compile this presentation, and all sources are listed in APA format. Here is the second slide. Here's the final slide. I do want to thank you for taking the time to listen to this presentation, and I hope that it has offered some valuable insight into this community and contributed to a deeper understanding of how to provide compassionate, effective care for individuals with IDD.